Hello everyone, welcome to the calculation series. Seventh question. This is the lengthy question, but once you get the solution, this question will be easy. Okay. Seventh question. You are visiting the urban MCH subcenter for annual evaluation of services provided. The health center caters to 10,000 population. How many ANC registration should be there at any time in a year of evaluation? Okay, this is the question that typically which takes place in the PHC and subcenter level. Okay, if you are a now health officer, you are visiting the subcenter now. You are opening the ANC registration book. How many ANC registration do you expect to be present in that book? Okay, or that area. See, think I am visiting the MCH subcenter on November 2025. To know ANC registration, I should know total number of ANCs first. Okay, it depends on the total number of live birth in a area. First, see, if to know the how many got a pregnant, we have to know live birth rate, isn't it? If we know the live birth rate at that subcenter, we will know how many have registered, how many were pregnant. Let's see. First step is to calculate live birth. What is live birth? It is a crude birth divided by 1000 into population. If here they have given 10,000 population, okay, but if they have not given any population in the question, you can just take the subcenter population, that is 5,000. Okay, okay. Crude birth is 20. It is nothing but the national crude birth rate in India. Okay, it's something that is already calculated one. You should keep that in the mind. That is Indian live crude birth rate in this year is 20. Okay, so you can use this 20, that is 19.5. For easy calculation, we are taking 20 per 1000. Okay, into 10,000, we will get 200 per year. Okay, per year there were 200 birth. That means there were 200 pregnant women, isn't it? So is that the correct number? See, in the book you have opened, there might be you have registered one ANC case, but she got aborted or she got some miscarriage or something. Okay, so we have to consider 200 pregnant women plus how many wastages. That is, in India, the 10% of the live birth is pregnancy wastage. Okay, 10% of the live birth. That means it's not just a 10%, it is a 10% of the live birth. That means the 10% of the live birth. How much was the live birth? That is 200 per year. So 10% of the 200 is nothing but 10 by 100, that is 10%, into live birth is 200. So 2020 cancels 20. Yes. How much was the live birth? 200. That is 200 pregnant plus pregnancy wastage is 20. So there will be total registration per year is 220. Last step is the ANC registration at any given time in a year should be more than 50% of the expected annual pregnancy. Okay, that should be registered. That means what? See, the 220 was the total pregnancy register that should be registered. But what is the criteria? Whenever you go for a PHC, the more than 50% of the cases should be registered. That means 50% of the 220 is nothing but 220 divided by 2, that is 110. So when you visit in the November 2025, the registration book should contains 110 pregnancies. Okay, yes, I think you understood. If any doubts, please comment so that I can again stress upon the question. This type of questions sometimes they might ask, we can't predict. Okay, so this is easy question, but some things you have to remember, like crude birth rate, and 10% of the live births it's the wastage, and 50% should be registered whenever you go. Okay, thank you.